on top of it to become a specialist. I think the reimbursement schedules are very unfair, and it doesn't really necessarily take care of physicians that are passionate about what they want to do, how they want to take care of good care of patients. Are okay with it, but now there are the whole new generation of doctors that are coming out, and they take this as a job. And I'm really, I can't blame anybody, because the way the reimbursement structure is, people cannot be passionate about it anymore. I mean, I come from an old school. I've been in practice for 20 years, so it doesn't bother me as much. But really, a lot of new medical school graduates are taking it as a job, and it's coming to to me, it's a shame.
I think what is especially a shame is the number of geriatric doctors we have. We spend lots of time on these patients. We go through a lot of different histories and physicals. Many times we cannot do much for them, but we sit and talk with them. There would be an hour, 2 hours easily of a geriatric assessment. But the reimbursement to me is really quite shameful, because, they get least reimbursed. And we hardly have any physicians going to nursing homes. I'm the medical director in a couple of nursing homes. It is so hard to find physicians going to the nursing home. It's only getting worse and worse.
What about the role of patients themselves? We talk about people who want to live a healthy lifestyle. It is obviously we look to the physicians to take care of the patients, but isn't there a responsibility somewhere that if you live a healthy lifestyle, or you do, you take it upon yourself or educate yourself, etc., is there some thought of, having that addressed in there, that somebody who's healthier or better, just like you take life insurance, you get lower premiums if you have that.
See, that's the thing. I think that, our society is getting away from taking responsibility for their own actions. And if we are going to, my problem with government option or public option is, I think it's the beginning of one payer system. That's what it's leading up to. And there should be financial incentives for patients that really take on a healthy lifestyle. Why should that patient, even though I'm against discrimination, and I think people should not be denied access to health care because of their pre-existing condition, but I'm of this opinion that if somebody wants to smoke 3 packs of cigarettes a day and want to have 5 drinks a day, why should he or she pay the same amount of health insurance as somebody else who wants to spend every day jogging do not get into any unhealthful health behaviors?
But on the other hand, American medicine has been procedure oriented. So on the flip side, I think diverting money to preventative care and to PCP is not a bad thing, because excessive amounts of money were going in the past to specialists. So I agree with certain aspects of the bill to shift the money to preventive care and PCP, although I'm a specialist, so it goes against. And the other positive aspect of the bill is patient outcomes and evidence-based medicine. So that again is going towards preventative care and ascertaining the perception of patients and how they feel about their physicians. So reimbursement should not be based merely on procedures or the qualification or how many years the physician has spent in training, but the patient perception outcomes.
There must be some way that even if my insurance is paying it, for me to really understand what is it costing me and costing everybody else, because most Americans don't really understand that this visit or going again and again is really impacting us, and I think there must be some way to address this issue.
No, but Blue Cross Blue Shield or one of these bigger companies will send you an itemized bill.
Right.
So they won't send you that you have to pay, just a copay, but they'll list exactly what the visit costs, the MRIs.
If you actually sample across, patients are feeling sorry for doctors now. As a primary care doctor, we don't have high-ticket items to begin with. And, to do a whole physical, you will not believe that we, a half an hour time with the physician, not including nurse triage time and appointment time and medical assistants doing blood pressures, vision, hearing, that you'll be surprised there's not more than $30 to $40 by some insurances for for a whole complete physical exam. So some providers are going to rush through it. They're just going to listen to your heart and lungs and say, okay, you're in good shape. See you next year. All right? But what kind of incentive is that for good providers to go through the whole history of the patient, family history, medication list, the whole 9 yards, and then, spend and let them